Hi guys, let's discuss paracetamol, also known as acetaminophen. Paracetamol has been available as an over-the-counter medication for over 50 years and continues to be used widely for acute and chronic pain. What is the mechanism of action of paracetamol? Paracetamol have many mechanisms of action. One of the main, as I consider, is COX-3. So COX-1 inhibits COX-3 and modulating pain via stimulation of descending pain pathways. COX-3 or cyclooxygenase enzyme has been described in the brain and spinal cord and is proposed to be the site of action for the antipyretic and analgesic effect. COX-1 is non-selective or found at many sites in the body. How about pharmacokinetics? So absorption or availability of the drug is high. If you are giving through the IV route, you have 100% of drug. If you are giving through the oral administration, you will get bioavailability of 80% of the drug. Bioavailability means the amount of drugs that can reach the blood or bloodstream. So it is absorbed in intestine very well. How about the distribution? It have a high volume of distribution. Metabolism, important part of the drug. It undergo hepatic metabolism by glucuronidation and mainly in two inactive components that are excreted in urine in inactive or unchanged form. In normal condition, a very small amount of the toxic compound, I call it N-acetyl P-benzoquinone imine. But this is rapidly inactivated to non-toxic metabolite. It occurs at a low doses. But this system can rapidly be saturated and in case of overdose or some abnormal liver function. As you know, there are many cases of low glutathione or conditions where glutathione stores are low, like malnutrition, chronic alcohol use, comorbid liver disease, and some medications like phenytoin and carbamazepine. When liver is exposed to a lot of drugs or toxins that require glutathione action, it will be exhausted. So N-acetylcysteine or NAC is antidote for paracetamol overdose, acting like glutathione to neutralize NAPQI by binding to it. It is very effective, especially within 8 hours of overdose. What are side effects of paracetamol overdose? Hypotension, flushing, tachycardia, deranged liver function test or abnormal liver function test, liver damage and failure with overdose, hypersensitivity reactions like Steven-Johnson, toxic epidermal necrosis, acute generalized exanthematous pustulosis. You have to know that Steven-Johnson is a diagnosis. This diagnosis is based on involvement of less than 10% of the skin which is affected, and it is known that toxic epidermal necrosis affect more than 30% of the skin area, and percentage between these two values is called intermediate affection. What are the toxic doses and how to treat them? So 8 to 10 gram by one time. If you are taking this dose, you can become overdosed. So In adult, you see that 150 milligram per kilogram in 24 hours, and in children, 200 milligrams in 22 hours. So, for example, this value, if you have 200 milligrams for a child with for children with 7 kilograms, so 1 gram for 100 milligrams will be enough to declare this overdose and toxicity. If you want to treat overdose, you should give N-acetylcysteine, which is proven that help in less than 8 hours prior or after the induction of the overdose of paracetamol. But it is demonstrated that you can give at any time after the ingestion of a lot of paracetamol. This N-acetylcysteine, as this works by uh, regenerating glutathione and binding the drug and neutralizes. So 300 milligrams, if you are giving to the 70 kilogram adult, you'll have around 21 grams of N-acetylcysteine. But this drug is firstly given for mucus secretion clearance, especially in a patient with pulmonary disease. Thank you for your watching. Have a great time, guys.